Now from the Center for Family Health, we have Nate Nimtz, who's the Support Services Manager, and registered dietitian Haylee Kakowski. Welcome to the show.
Thank you.
Good morning. Good morning.
Yeah, good morning. Thanks for having us.
It's kind of fitting we had our little cereal quiz
Right?
with a dietitian in the house. Probably your worst nightmare seeing some of those cereals. Nate, introduce Haylee, the dietitian, to the staff.
Yes. So Haylee Kakowski started with us in December of 2023, so just the end of the year. She actually was an intern. We've had a dietitian program at the center since 1991 when we opened, but she was an intern in 2020 with our current dietitian, Stephanie Skonos.
Awesome.
So yeah, she's joining the team. So yeah, very exciting.
Well, full service center.
Yeah, of course.
Yeah.
It's National Nutrition Month, and why is that important?
Yeah, I mean, nutrition's important, right? We need nutrition to live, but it's really important to make sure we get our nutrition information from a registered dietitian.
Sure.
And not all that misinformation that can be on the internet these days or social media. Yeah.
How does a dietitian fit into the delivery of care at the center?
Great question. So,
great question.
yeah, so, we at the center, we have, I think you always call it, you just did, a one-stop shop, right? It's a little bit of everything. And we offer all of our support services at the center. And it really fits in with our, we call our model, integrated care model, right? So I can let Haylee talk a little bit about what that looks like specific for the dietitian role. But
Yeah, so it's kind of different than other places because we can follow with them. So it's not just like a one appointment thing, one and done. So we can be called down in real time to meet with them at their provider appointment. We can be referred to them after they meet with a community health worker. There's a lot of all those open doors and connections to be able to see us at the center and work to improve like clinical outcomes like A1C, blood pressure, things like that.
Yeah, it's interesting how our diet can really affect our overall health. What are some things that people can do to kind of just be aware of what they're eating? Like you said, there's a lot of misinformation out there. You don't want to fill your meals with those sugar cereals.
Honey Smacks.
Honey Smacks, good Lord. But some people do that, 3 meals a day. Yeah. What are some good things we can do to kind of, as we head into spring, kind of maybe adjust a little bit?
Yeah, I mean, just reach out to a registered dietitian would be a good idea. So like if you're getting information online, I guess make sure it's a credible source from an actual registered dietitian because we're the food and nutrition experts. So maybe paying attention to where that information is coming from before you start to implement it.
So your dietitians are better than somebody else's dietitians, right?
you said it.
Yeah, what makes a visit different?
Great question. So I think, with our dietitian specifically, they really focus on, I mean, Haylee said the food and nutrition experts, right? But even more than that, they're behavior change experts. Just like our behavioral health consultants, it's really, I was just talking to Haylee the other day and I said, it's really like therapy, right? Like, and they're really getting at the reason behind it, right? It's not so much don't eat this. It's really the why and kind of uncovering things. Yeah.
Well, it could be exciting to follow your advice because you might be trying new foods or eating at different times. New strategies. It's more exciting than taking pills or getting shots or whatever else you might have to do.
Yeah.
What's the worst thing that people are eating right now in society?
It's not about what, it's about how much.
Okay.
So, yeah, everything in moderation.
Okay, everything in moderation.
Yeah.
That's what I've been saying.
I know, you've been saying it the whole time.
How does someone, you make an appointment to see a cardiologist, you figure out what that's going to be like, but what is it like to make an appointment to see a dietitian?
Yeah, at the center, they can just call, any patient can just call and set up an appointment with us. They just ask for us. But they can also, like I said, they can just ask anytime at any other appointment at the center. We offer groups, so they can show up, any patient at the center can show up to our groups. We have 3 that have been going on for 3 years, one of them, 20 years, the other one, diabetes workshop groups, wellness groups. things like that.
And you know,
yeah, go ahead.
in that I said integrated care, right? So what we see happen a lot, and it doesn't have to happen this way, but it does happen a lot, is the provider goes into the room, they're meeting with a patient who has diabetes, maybe, their A1C's high, it's consistently been a little high. At that point, they're gonna call, they can call Haylee or call Stephanie, our other dietitian, and she would go into the room. So they're also collaborating with the physician too, in real time, right there at your doctor's appointment.
Yeah, it'd be nice to hear from someone local too, instead of just, you see all these crazy commercials.
Of
with
course.
Ask your doctor about this,
of
that,
course.
and the other.
Yeah, it's about removing those barriers, so we
Right.
can just meet with them right away rather than having them have to leave and then call, or they can do that, but
I think historically, the diet, a bad diet has been linked with lower income. Is the lack of resources, particularly money, impacting someone's poor diet?
Good question.
Yeah, it can, right? Yeah, I mean, especially if we don't have access to, fresh fruits and vegetables, things like that. So that's why we are there. Also, community health workers are there to connect patients with those resources in the community to get access, as well as our expertise to help to still decide and to help them navigate through the foods they are able to afford or have access to, decide, help them understand what are still good options.
And one thing to keep in mind too when we're making food choices, right, and if finances are a barrier, we're making the best choice for us based on what we have available to us, right? So if your choices are a can of green beans or something else, that's really not good for you, right? Go for that can of green beans. Rinse them first, get the sodium out, and it doesn't have to all be fresh fruits and veggies and things like that. Obviously that's number one, but we want, and that's one thing, we have a food pantry at the center, and that's one thing that our dietitians often do. They'll go to our pantry and then help folks that way.
Andy, why don't you tell Haylee what your 4 major food groups are?
My 4 major food groups are Diet Coke,
Okay.
Pizza, candy,
Yeah.
and Wendy's.
There you go.
How's that?
All in moderation.
All in moderation, of course. All in
moderation.
moderation. No, that's not true at all. But we could all use some more fruits and vegetables. Me in particular.
Well,
Al Michaels has never had a vegetable in his life.
That's right.
Yeah. He's doing just fine.
So can you just call and say, hey, I'd like to come in and talk to you, or how does that process work?
Absolutely.
Yeah.
Yep. Yeah, I mean, we're pretty low barrier as far as getting connected, so give us a phone call and we'll get you connected with one of our dietitians, and see what we can do to help.
In-person appointments, phone appointments, Zoom appointments. There's a lot of options.
Fantastic. Great to see you both. Thank you.
Yeah, thank you both.
Thank you.
Our downtown neighbors from the Center for Family Health, registered dietitian Haylee Kakowski and support services manager Nate Nimtz. More of the morning show right after this.